Troponin is a protein found in cardiac and skeletal muscle fibers. Healthcare providers use it as a marker to assess heart damage. It can be measured with a simple blood test. Any person who comes to the hospital with chest pain or other heart attack symptoms will have their troponin levels checked. The initial findings of the research were presented at the European Society of Cardiology, ESCAPE, Congress last week. One of the researchers, Roi Westreich, MD, PhD, of the Soroka University Medical Centre in Beer Sheva, Israel, demonstrated that troponin can be detected in a saliva sample more rapidly than it can be in a blood sample. Westreich tells Verywell he and his colleagues tested the saliva of 41 patients with elevated blood troponin levels and compared the results to the troponin levels of 66 healthy volunteers. The samples were tested before and after being treated with a process called saliva high abundant proteins effective depletion, shaped, that removes excess proteins from the saliva. Since no test has been developed for use on saliva, we had to use commercially available tests intended for whole blood, plasma, or serum, and adjust them for saliva examination. Yoav Newman, PhD, the study's lead scientist on behalf of Salignostics, Limited, said in a press release that was published by the ESCAPE. The researchers found that 84% of the processed saliva samples from participants with troponin in their blood also showed evidence of troponin. Only 6% of the unprocessed saliva samples showed troponin. Patients with lower blood troponin levels were less likely to have positive saliva results. The samples from healthy volunteers yielded a 10% false positive rate.